You think you don't have to work on your muscles when you're older? We think differently. Your body can build muscle at 50, 60, 70, and through the rest of your life.
Muscles may look good, but they're not just for looks. They serve key functions too. And that's why today we're going to explain why you, no matter how old you are, and even more so as you get older, absolutely need to make sure you build and maintain muscle. And in the end, you'll be surprised at how surprisingly simple the solution actually is. Do you actually know that there's a disease, a common one, that countless people among us here in Germany have, starting, I'd say, at around 40 or 45, and that really affects so many people in their daily lives quite a bit? It affects a large percentage of those people as well, and it's the disease called sarc, if I'm perfectly honest. Sarcopenia, literally loss of flesh. It means we're losing muscle mass increasingly, and our bodies are breaking down muscle tissue as we age, gradually over time. And that's, of course, a disaster for anyone who wants to stay healthy and live well for a long time and maintain their vitality into old age and remain active.
I don't get it. I think and strongly feel that as people age, society in general does increasingly less and less about it. To keep their muscles simply by not exercising enough, not putting enough load on the muscles. So they naturally waste away. Now it's called a disease.
Yeah, but you can't just declare that everything you're ultimately responsible for isn't a disease, as if responsibility magically makes it so. Because type 2 diabetes, you're responsible for that too. For a whole lot of cardiovascular diseases, you're responsible for as well, and so on, honestly. That's why there are so-called civilization diseases we're largely responsible for through our own lifestyle choices. And I think it's really good that sarcopenia is now actually recognized as an official diagnosis you can put on the sick note when the doctor fills out what the patient has in official records. Because then that term might actually make its way into the much wider general public more broadly, along with all the consequences that come with it. And that's something we'd like to take a bit of a closer look at now.
Yeah, it's about the reasons why you should build muscle. Absolutely. That's exactly it. No question at all. But I mean, the first reason is pretty obvious. You want to actually still be able to move. You want to be able to move, right? And muscles are basically the body's only real instrument for that purpose in everyday life, so to speak. They're what let you move. You can't move without muscles. And that's why it's so incredibly important. The stronger and more powerful your muscles are, the better and the more capable you'll be. So just to be able to do all the movements you want, whether it's playing sports or just going for a hike or pretty much anything else, whatever. We live in a body that moves. You go to the toilet, you go here, you go there, and you keep moving around. You can only do that with muscles. And the better those muscles function, the better you'll be able to move freely around. Reason number one.
And what you also know is that if you've got a lot of muscles and you move them, or even just move the muscles you already have, you also activate certain chemical messengers throughout your body as well. Those are the so-called myokines. They're a bodily marvel since they keep inflammation in check across organs, help coordinate immune responses, and balance the system overall. To shut them down in the body, to make them stop so we can heal again, so we get healthy. And they're only produced in muscles, so we need muscles for that first, and then those muscles actually have to be moved properly too.
They're like genuine little hormone factories, really. I remember exactly, how long ago were they first discovered?
About 15 years or so, I think.
Yeah, from that Swedish doctor, I think.
I think she's called Professor Peterson.
At first, there were just a handful. I remember maybe 10 or 12. Today we know that more than 10,000 of these muscle hormones help ensure that your body can function as best as possible. Just imagine it. But mind you, those factories need to be there. So the muscles have to be physically present and in working order, of course. And like Petra said, those muscles really need to be moved. And if that doesn't happen, then no muscle hormones will be produced whatsoever, not even the tiniest trace at any point. Which the body very urgently needs, otherwise it wouldn't have that double function, would it? I always find it fascinating to observe in the body how muscles, which are actually meant for movement, are at the same time hormone factories.
For a lot more, obviously, that's why we need muscles for a properly functioning metabolism. and it's for the entire body as a whole. If there's no metabolism taking place in certain parts of our body, then what really happens? Then use it or lose it. So that pretty clearly means if we don't properly get certain areas into action, the local metabolism simply just doesn't work as well there.
The problem is most people think the heart alone is responsible for metabolism and nothing else contributes. True. But the heart's a muscle, not alone.
Alone, that's all alone.
A lot of people think that. Yeah, but that's really not right. They don't realize it. Yes, of course it's not right, but they still don't realize it. And we want to clear that up right now. So your heart is, of course, the main driving engine. Yeah, blood flows through the larger vessels, but then it goes into the smaller ones, branching into tiny capillaries that spread through the tissues. And into the tiniest ones, the capillaries. Physically, it's been shown that the heart doesn't generate enough force to push blood through all those tiny capillaries. There simply is not the pressure to drive blood through each and every one at once. I think it's like going to the moon and back, I think, in length, like endless numbers of those tiniest vessels, and the pressure gets spread out over them. What's my point? What people need for their metabolism to really unfold in the body is constant, regular physical movement every day. And it's the muscles that move. And there are indirect factors too. For example, running alongside the veins are the arteries, and the arteries still pulse. And that pulse wave in the artery carries through the tissue right up to the vein, gently aiding the return of blood toward the heart. That gets squeezed, there are venous valves, and that really helps the blood to flow through. So the body has loads of flow mechanisms built in, but the muscles are actually definitely the single most important factor for keeping fluids moving around the body. You know, when people lie there, they're not doing well, they just keep getting worse, and the moment movement comes, all the tissue can start coming alive again, regain function and vitality. And that's what the muscles all over your body do. The more you move, the more they actively work. They make hormones, they run your metabolism. All life comes through movement.
When I started looking around the medical field about 50 years ago, it really was like that. People who were sick, say after a heart attack, were basically tied to their beds for 6 weeks with almost no mobilization. They were not allowed to move. Illnesses generally meant moving as little as physically possible at all. That's an absolute catastrophe, and I'm so incredibly glad it's different now. Because even with a myocardial infarction, I mean a heart attack, you do need your rest phases, but you get back into moving much sooner. Even with other illnesses, it's constantly necessary. And people keep repeatedly stressing how important movement is, even with cancer or after surgery.
Or after falls or following any physical injuries as well.
Pretty cool.
Pick any injury, whether it's a torn ligament, a broken bone, a muscle tear, whatever it may be, it honestly doesn't really matter at all. If you compare immobilizing it, resting, protecting, and having it repaired with gently as much as possible, keeping it moving and functional to promote recovery. Huge differences. So I'll just say, from my side, I can't prove it with any studies, but from what I've seen in many cases, the recovery timeframes tend to drop down to about a third or even a quarter, if the movement is preserved. Of course, if something happens, say a muscle fiber tear, that's a muscle fiber tear. There was some kind of fall or a big sudden strain. The fascia wasn't right, something's torn inside. It's bleeding into surrounding tissue. It's all good. Now the body's starting to heal it. Option 1, you keep it completely still and say no movements allowed. Then that'll take 4 to 5 times longer than if you keep moving as the body allows, letting it guide you within its limits while gently pacing, just because of the metabolism.
Why are you so into theory anyway? I'm sitting right here. Just under 4 weeks ago, I had a fall, and I had exactly this here on my foot. I tore several ligaments. It was seriously swollen. It looked pretty blue, and it hurt pretty badly for quite a few days. That's what I did. I actually stayed in bed for 2 days, just barely managed to hobble to the toilet and back. Then I got up and moved around, and I'm absolutely thrilled, really, right now. I hardly feel anything anymore. I even started proper training again, strength training and all, and sometimes there's still a little nudge like, hey, stop, that's a bit much, and a bit is exactly right, that's just the thing. I can tell straight away, hey, maybe you did a bit too much, you need to watch it. But after not even 4 weeks to have a foot that actually works again, I've also got my balance back, because that's really important. So I can walk confidently, move more freely again, and get back to normal daily life. Because you lose it quickly. I'm genuinely really thrilled. I can only say, if you're injured and need to lie down, then lie down, but make sure to get up straight away. And that's also one reason why building muscle is so important. You end up falling less.
Yeah, but let me make that a bit more concrete for you who are listening, because you might be wondering, aha, a torn ligament. Why on earth do they recommend moving around? In a very specific way. Like you've injured something. Say a torn ligament, for instance, just to be clear. As soon as you can put weight on it at all, hang on to something and walk really slowly and avoid the pain, because that warning sign is built right into your body, telling you what movement you can and can't do. So listen to it and don't push beyond what feels safe while you heal, and respect that signal. The pain. Walk and think, oh, that hurts. Then avoid that angle. Keep walking and try to move so slowly, like in slow motion, if you absolutely have to, honestly. If you avoid the pain, then everything's fine. And also, with a muscle bundle remnant or something like that. Exactly the same. Move and don't be at all afraid it'll tear that wound open again in any way whatsoever. Because that's biomechanically really simple to understand. With these injuries, there are peak stresses that are much, much higher than the normal load during a regular movement. That means you can move normally and the healing still goes on, and it'll even be better because movement brings things back to the metabolism, so it happens much faster, and then eventually you only hold yourself like this. In that area, you could brace yourself if something happens, you'd always be secure. Then you start to stand on that one foot to keep your balance because of equilibrium, and then you close one eye and your depth perception goes away, which makes judging distances and stepping safely much harder and can easily make tasks feel unstable or increase the risk of stumbling. Then it gets harder. The foot swings get bigger and all the support muscles that have to rebuild, the ones meant to replace the ligaments, get trained. Then you close your eyes completely, but stay ready so you can brace yourself if it becomes necessary at any moment, just in case. And then you'll be surprised how quickly an injury like Petra's will have you walking again and getting better at using your foot all the time, steadily regaining confidence with every step. But back to fall prevention, like you mentioned earlier.
Yes. This is so important because there are so many older people.
And this affects you too, have you forgotten? Because this young woman just fell down the stairs and was seriously hurt.
Yeah, true.
And I'm absolutely sure that if you hadn't done the strength training, our exercise that includes the strength work, everything would have gone completely haywire. It would have turned out much, much worse, no doubt whatsoever, really.
I think so too. And the reason I fell was that I just wasn't paying attention. I was lost in my thoughts, who knows where. And I just missed, while I was walking through a stranger's house, that there was one more step than I'd expected. But generally, it's just important to build up muscle, to help prevent falls, because there are so many people who actually then just suddenly lose their balance and fall in a split second into a downward aging process because they've fallen, broken something, and can't move anymore.
Everyone does too.
Yeah, that's odd.
Everyone treats it as normal, assuming the older you get, the frailer you should be, or that you're biologically programmed that way. So many just see it as sadly inevitable and unchangeable. And that's completely wrong. Don't believe that. It's completely wrong. That's because the muscles just aren't being trained anymore, honestly. So do our exercises. They'll keep you flexible and limber and include strength work to help you stay pain-free and keep muscle tone overall. You probably know if you do them regularly. If not, go online, try our exercises and check them out and see how much they really help you. Because if you do stretching and strengthening and active stretching, which basically trains the joints activation, and you do that regularly for your whole body, then you'll simply have muscles that are more balanced and resilient, that take care of all the things you want muscles for, essentially speaking. Of course, the building material also has to be supplied.
Exactly. And just quickly on that, you of course also need enough protein and just to sew. To give a very simple rule, especially for people over 65, they say definitely 1.2. grams of protein per kilogram of body weight. And if you have that, try to spread it fairly evenly throughout the day. Then you've definitely got enough of a base to build muscle. But want to hear something really surprising? There are so many people who, the older they get, have such low protein levels, it actually really scares me a great deal. I also don't think having too much protein is good, because that's not optimal for the body either. But having too little is just as dangerous, so you've really got to have the right balance, eh? So think about protein and make sure you consistently get enough of it every single day, without fail.
Which is a practical problem if you're listening now. How much protein am I actually getting in total each and every day? There are apps nowadays that are so simple. You just snap a photo of what you're eating and it tells you how much protein's in it. It's not super precise, but at least it gives you a rough overview. And over the past few months, we've found that when we've spoken with a number of people, some of them were only getting about 25 to 30 grams per day at around 60 kilos of body weight. And that's far too little. It's not even half a gram, it's less than that. Exactly, less than half a gram per kilo. So take care, build muscle, train weekly, stay committed, and keep at it every day. Do our exercises, or hit the weights, or go for a run, whatever actually builds muscle. Always push yourself so the body can adapt over time.
And be a good example for everyone who comes after you, because they'll be like, wow, they'll tell others how you did it for sure. My dad, my granddad, my great uncle, my dad was so fit because he ate well, exercised, knew a lot about his body and his health, and he was also really active and sharp. You're not doing it, right? You don't have any grandkids at all yet, do you?
Coming soon.
But that's still coming, exactly. So that's why we're doing well with the muscle building too, okay?
You can clearly tell there's a great deal to know about muscles, and that really should be public knowledge. A lot of people don't know that, so share this video with everyone you know. They'll thank you and be glad